Um, Good afternoon, everybody. Thank you for joining us, or good evening and good morning, depending on what your time zone is. I'm your moderator for the next hour. My name is Scott Delaney. I'm a climate change epidemiologist here at the Harvard T.H. Chan School of Public Health. And I'm joined today by Nat Steinsultz. He's a data scientist at WattTime. WattTime is a environmental nonprofit working to help businesses and policymakers and researchers like myself slash emissions using some genuinely novel data streams that they've developed in-house. Nat's one of the developers of those data streams. He also wears many other hats in addition to his data science activities, his talents in data science. He also has a background in design and in advocacy, and in a prior life, completed a PhD in physics. Today, he's going to be talking about WattTime's relatively new high resolution. It's a real-time data product that estimates the health damages, the health effects of electricity consumption. This is a relatively new data stream that WattTime has recently made available. I can tell you that Nat and I are collaborating on other projects, on related projects, and I can say from personal experience that the data streams that WattTime is able to put together, including the one that he's about to share with you all today, are really novel. And I have full confidence that they'll be able to produce novel and meaningful and real tangible impact on the climate crisis. So a quick note on logistics. I think the chat function and the Q&A function should both be active today. So for the audience members, please feel free to submit any questions using either function. We will have time at the end for a good discussion. My understanding is that this session is being recorded, just for reference. But with all of that said, Nat, thank you very much for your time and for taking the time out of your day today to share some of your work with us. So the floor is all yours.
Yeah, thanks so much, Scott. And thanks for the introduction. I don't think I really have anything to add to that. So I'll just go ahead and get started with the presentation. Okay, so first off, why does air pollution matter? I suspect many people here already know this, but it's always important, I think, to ground this in the impact of the problem we're trying to solve. Some studies have estimated that up to 1 in 5 of all deaths worldwide are caused prematurely from fossil fuel related air pollution. In the US in particular, where the rest of this work is focused, it's been estimated that that's up to 107,000 premature deaths in the United States alone per year. With up to 57% of those emissions associated with energy consumption. And finally, we know that this air pollution, this particulate air pollution in particular, disproportionately and systematically affects people of color within the United States. So not only is this a huge public health issue, it's a huge equity and justice issue as well. So I'm going to talk a little bit about what WattTime does and where we got started and how we estimate emissions from electricity. So the most driving factor behind WattTime's foundation and all of the work we do is to try to understand the marginal emissions rates of electricity systems. And so what that really means is we're trying to understand who is responding to changes in load when you make a change in a specific place at a specific time. So our electrical grids are made up of thousands of generators connected to millions of sources of load. And at all times, that generation has to be balanced with demand. So when you change your demand by plugging in an EV or turning on the light switch, you increase the demand on the grid, and that has to be matched by a change in generation elsewhere on the grid. And so we're developing these models to try to understand what is responding. And because sometimes that change in electricity usage, it can cause a clean power plant to be the one that's responding, so that by using energy at that time, you're using energy that would have been wasted elsewhere. But at other times, that can cause a dirtier unit to respond. So maybe if you plug in your electric vehicle at a specific time of day, a coal plant is the one that is ramping up their generation. And so we've developed a lot of models to try to understand that. Another really big element of understanding the grid, particularly in the US, is understanding renewable curtailment, because that's a really new, emerging and growing area of opportunity for reducing emissions. And renewable curtailment happens anytime that there is more renewable generation on the grid that then can be used by the demand on the grid at that time. So in particular, we see here plotted wind and solar curtailment by month in the California ISO, where California has a large amount of solar energy installed. A huge percentage of their generation comes from solar. And during the middle of the day in particular, that sun is shining, those solar panels are producing, they're producing energy, but not all of that energy is able to be used. And so that energy is curtailed or really just destroyed. So that's an example where there's a huge opportunity to shift from different times of day to times when renewable curtailment is happening, because you could use that energy, induce no additional emissions from using energy at that time, and then avoid charging your EV later in the day when a gas or coal plant might be responding. Okay, so that's kind of the fundamentals. This is a very, very quick overview of the grid and where we start to think about marginal emissions. So the core of WattTime's work, and I'm not going to go into too much detail here, but I want to give a little bit of an example of how do we estimate marginal emissions. So marginal emissions are, by definition, a counterfactual. They are measuring how much would emissions change if I made X change in demand. And so there's not a way to directly observe it, right? We can't build an electrical physical sensor to measure a counterfactual. And so we have to apply different methodologies to try and estimate that counterfactual. Now, there are multiple different ways that marginal emissions have been estimated throughout the research and throughout the literature. But the approach that WattTime uses is based off of using empirical models. So that means that we're using it based off of historical data on generation and emissions. And we're using causal inference through regression-based models. And so at the simplest version, what that looks like is we regress the total change in emissions against the total change in generation, and we get an average rate. Now, what we end up doing is we end up slicing that into smaller bins. So we look at specific regions within the grid, and we look at the emissions from generation within that region of the grid. We also split up the time based off of time of day and also grid conditions. So we know, the middle of the day on spring, maybe the marginal emissions rate looks like this, and the middle of night in summer, it looks different. We include factors like total load and total price as other binning factors that we use. And so we use that in the US. We're fortunate to have data from the EPA's continuous emissions monitoring system, which provides hourly total emissions levels as measured through every plant larger than 25 megawatts in the continental US. I mention that because that's also a critical part of our input data for developing the health-specific models. But we also use data reported from the ISOs and balancing authorities, either directly from them or through the EIA's websites. And we're using these empirical-based regression models. And what that leaves us with is we run these models, we create these models where we estimate the marginal emissions given grid conditions. And then in real time, we collect data on those grid conditions, and we use that to infer what the marginal emissions rate is in real time. So we create marginal emissions rates every 5 minutes. We have an API where we're constantly updating new values every 5 minutes for the local marginal emissions rate. We also produce a rolling 72-hour forecast that we also update every 5 minutes. And I'll talk about the applications and how our partners are using this signal. But as you can imagine, a forecast is a really critical part of being able to actually do anything with this, because if you're if you're making an electric vehicle charger, you say, well, I know I need to charge sometime. So when is the cleanest time to charge? You need to be able to predict in the future to do that. This talk and this health-related data is only available in the United States, and that's because, in the continental United States, I should say, and that's because of limitations on the data, because we have that continuous emissions monitoring system here in the US, but we don't have that kind of granular data available in other countries. But for carbon marginal emissions, carbon dioxide marginal emissions, which is the core of what WattTime has developed for a long time, that's available in at least 42 countries worldwide, and we're sort of constantly growing the areas where we have that available. So this is an overview of, at a high level, of how we estimate marginal generators and marginal emissions overall. And this is primarily for us historically been applied to carbon dioxide emissions. That's where sort of WattTime got started. But I'm going to talk a little bit now about how we've adapted that model to incorporate health emissions, health damages relating from emissions. And so really what we've done is kind of glued together, I'll say this, we kind of glued together two models. So we have all of these regression-based models where we can estimate the change in generation at a single power plant using all of these models that we talked about. So we start to estimate the change in generation at a single power plant due to a change in load in a specific region. Once we have that data, we can start to turn to other models to estimate what is the health damage from that change in pollution. So we know that the change in generation from the EPA emissions data. We also know the change in pollution from that EPA emissions data, because that depends a lot on what fuel, what type of generator is it, what type of pollution controls do they have. And so we know this change in pollution. We then use a model to model how that air pollution spreads across a geographic area. And in our case, we've utilized the INMAP model developed by Chris Tessum. We in particular use the INMAP source receptor matrix. It's one of many such models that allows you to estimate how air pollution spreads, how the chemicals transition from the way that they're emitted to the forming particulates. I'm sure there are lots of people here who are much more versed in that area than I am, so I don't want to go too deep into it. But there are many such models. And after evaluating our options, largely in terms of ease of use, we ended up relying on an INMAP model because it was relatively quick to calculate these kinds of values. But it's important for understanding how these things are built up over time. So we have the INMAP model, which is telling us where the pollution is going. Then we're combining that with geographic data, because you know where the pollution is increased, but you want to know who is breathing in that pollution, how many people are breathing in that pollution. And so we're able to use census data, CDC mortality and health data to understand where the populations are located, as well as what their baseline health outcomes are. And then we combine that with estimating the total change in health outcomes across all of those geographic areas using epidemiological research and studies, looking at them and looking at studies which have estimated, what is the rate of change in premature deaths caused per change in, microgram per cubic meter of PM 2.5. And so we sum all of that together. So we look for a single power plant. We look at all of the places where that pollution goes, all of the people that are affected by that, how much those people are affected by that, and we sum that together to get an estimate. And what is the change in lives lost prematurely from one additional megawatt hour of generation from a specific power plant? And so we have that data now for every power plant that we have emissions data for, which is the majority, 98% of generators in the continental US. And so we use that combined with the regression models from the previous step to build a signal of, if I increase load in this location, how much total change to premature, how much increase is there in total lives lost prematurely? So I wanted to highlight here one thing that's really interesting that was novel to us and might not be novel to other people when we first encountered this is the actual, even though the methods are very similar between our CO2 and our health damage models, we found that the outcomes were very different. And that was largely driven by the fact that the relative harm between the dirtiest plants and the cleanest plants, when you talk about carbon dioxide, that relative ratio is close to 2 to 3, right? So the cleanest gas plants versus the dirtiest coal plants, you might see a difference between 900 pounds per megawatt hour up to 2,000 pounds per megawatt hour. So they're relatively flat. And so you see here on the left side of this plot, we have each plant in the US and their color and size corresponds to their average pounds of CO2 per megawatt hour. And we see compared to the plot on the right, the relative scale between the smallest and the largest is very different. And I think the big reason behind that, the reason that the health damages have such a larger ratio is because it's less affected by the plant itself. And now there can be large differences in the plant itself, particularly in pollution control technologies, which are or aren't employed. But also it's primarily driven by how close is it to a population center, right? We have huge disparities in population density between, the rural Midwest and New York City. And so even if you're distributing the exact same amount of pollution over the exact same area, for global greenhouse gases, it doesn't really matter where the emissions are sourced. But for these health damages, it's really important because this cloud of pollution might impact 10,000 people or 10 million people. And so that's where we find that the location and the specific plants are really important to get right. And that's why we see these really large differences in signals. Okay, so that's an overview of our modeling process. I don't know, Scott, if you want to stop for any questions now, or if we want to go on to talking about some of the applications of this.
So far, Matt, this is great. We have no questions in the Q&A or chat yet, which is just to say to the attendees, please don't hesitate to ask while Nat's presenting. We can always pause and answer. But so far, Nat, this is great. I think we can go on. Thank you.
Excellent. Cool. So I wanted to talk a little bit about combining these health and carbon signals because we found when we were doing this in practice, we talked a lot about when we were rolling this signal out, we were talking with partners about how they wanted to use these different health signals and carbon signals. I'm really asking someone to choose, do you want to save human lives or slow down climate change? It's not really a great choice. Like really you want to choose both. And I think one thing that we were really surprised to learn is that there's actually a lot of opportunities to do both. So this is also a good example to show what these signals really look like as time series. So I have here time series from 3 different grid regions, one where New York City is located, one where San Francisco is located, and one in Kansas. And so these are 3 very different grids with 3 very different behaviors and very different outcomes in terms of health and carbon emissions. And so we see this is what our data really looks like, and this is what our partners are using to optimize is they're getting this 5-minute data of the estimated value. And so on the left, we're estimating the damages to human health. We use dollars per megawatt hour, so that's using the value of a statistical life to convert that into dollars. And then on the right, we have the marginal emissions from a CO2 perspective. So that's pounds of CO2 per megawatt hour. And I think one thing that should stand out that I want to point out here, so you can see the absolute magnitude of these 3 signals can be very different. And it can be very different. The ordering is very different for health damages versus carbon emissions, right? From a carbon perspective, Kansas has some of the highest emissions, but from a health damages, that's much more true in New York City. And that's because the generators in New York are near very high population centers, so that even it's a smaller amount of pollution, it's impacting a much, much larger amount of people. And so we'll talk about the different applications here, but if we wanted to just optimize on a signal, let's say you're an EV charging manufacturer and you want to know when is the optimal time to charge a vehicle. It could be a little bit difficult because if you look at one signal, it might tell you one thing. And if you look at another signal, it might tell you another thing, right? Like, is night dirtier or is day dirtier? Is this time dirtier? Is this place? And so we actually found that we could combine these signals and co-optimize on those signals and still achieve the majority of opportunity for both carbon and health. And so what I have here is the results, and this is averaging across all of the balancing authorities in the US. The results in terms of impact per megawatt hour. These are all in dollars because we applied a social cost of carbon to the pounds of CO2 to convert it into dollars, and we added it to the VSL estimates from the health signals. I know that internally we always feel kind of dirty about using dollars to talk about impact, but it at least provides sort of a common baseline for us to combine these things. And obviously, all of these are parameters that you can choose, and we work with our partners a lot to understand what their values are and what values they want to implement. But the overall thing here, even if you just ignore the Y scale, the overall thing here that's important to understand is that if you just optimize for carbon or you just optimize for health, you end up leaving a lot of potential impact on the table by not including the other signal. So when we see on the left side, you have just optimizing for carbon dioxide, you still achieve some positive health impact because there is some correlation between the carbon and health signals, particularly I think if you look at renewable curtailment and a lot of our BAs and a lot of our balancing authorities, renewable curtailment is driving the majority of the opportunity for load flexibility. And so, you know, a wind generator that's emitting nothing, emits no carbon, also emits no particulate matter. So that's actually always really good to switch to that. But we also see for health, if we optimize totally for health, we can almost double that impact in the health damages, but we reduce the carbon impact almost by a factor of, reduce it in half almost as well. So then when we co-optimize, we combine these signals together, we see that we can still achieve, you know, 80–90% of that total impact on both signals. And that's largely because most of the time when you're doing something like charging an EV, you don't have to optimize every single minute of every single day. You just have to say, what are the 2 best hours out of the entire day, right? I need to pick 2 out of these 24 hours to charge. And so by co-optimizing, you can find a place that coincidentally or conveniently happens to be clean on both of those signals. And so I think that that's a really important thing where we found that these 2 signals do not have to compete with each other. There's actually a lot of opportunity to fix both climate-related emissions and health-related emissions. Was there a question that we wanted to address now, or do we want to? I can keep moving on with this, Tees.
Yeah, sure. Now, why don't we take some time real quick? So 3 actually. So the first is Ellen writes, out of curiosity, what is the social cost of carbon that WattTime is using? If you know off the top of your head.
I don't remember off the top of my head. No, I think
yeah,
we
no
might
problem.
have taken.
It's an interesting question. There's been in fact, I think the Biden administration just issued a new sort of federal regulation using a social cost of carbon. It's much more aggressive than prior administrations, and it's been one of the big regulatory changes and legal changes in the background that can have a huge impact on questions like this.
Yeah, absolutely.
So Ellen, thank you for that. The next question I have comes from Huva from the platform. And it is, what's the big drop in the time series represent on the prior slide? Yeah,
that's a really good question. Thank you so much for asking that. So that actually represents what I was talking about before, renewable curtailment. And so this is a thing that I went over quickly, but we do include this renewable curtailment estimation in our model, and that's actually a separate modeling step. We don't use the regression-based approach. We use a supervised learning approach where we get the ground truth curtailment data from the ISOs, the grid operators themselves. We combine that with pricing data to estimate when curtailment is happening. So that's part of the reason I selected Kansas. Kansas is a very interesting grid. It's in the Southwest Power Pool, and it's one of the states with the most renewable generation of any state in the US. So there's lots and lots of wind generation in Kansas, but not a large amount of load, right? There's not a lot of population there. And so that means that very frequently the grid in Kansas in particular is oversupplied with clean energy. So there's lots of opportunities to switch to those times so that when that drops down to zero, and you see the same thing in the San Francisco series, that's the California grid, has the same opportunities with respects to solar energy. There's opportunities to jump to where it drops all the way down to zero, because we think that renewable energy is actually the marginal power source at that time period.
Thank you, Nat. There's a couple more, maybe, yeah, we'll do a couple more and then maybe jump ahead.
Yeah.
So the next one is a little more nuts and bolts from Carla Sofia Campos Morales. She says, what is the resolution of the model? I assume, well, spatial and temporal resolution of the model.
Yeah, I can go back just a second. So the temporal resolution is we do updates every 5 minutes, and that's because grid operators are issuing, are measuring load and LMP changing every 5 minutes. The spatial resolution is dynamic in terms of where we have these emissions rates. That resolution is not dynamic. It varies depending on the size of the balancing authority. So in the US, we organize our grids into these concepts called balancing authorities, which are managed through the EIA. And a balancing authority could be something like SPP, which stretches from Oklahoma all the way up to the Canadian border, or it could be as small as a single village in Florida. So they really have a lot of different ranges. For the much larger balancing authorities, so these are the major ISOs, we break them up into subregions, and we do that to model this renewable curtailment, because renewable curtailment is primarily caused by transmission constraints within a balancing authority. So we want to break it up into smaller regions so we can say, hey, there's a lot of renewable energy available in Kansas right now, but it can't get to the demand up in North Dakota, for example. And that's because of a transmission constraint. So that's the resolution of our output signal. If there's a question about the resolution of the health damage model itself, that depends on the InMap model, which my understanding is it has a dynamic resolution. That's one of its features, is that it actually goes down to an incredibly small geographic resolution in areas where population density is the highest. But I don't know those numbers off the top of my head, but I'm sure that those are, they have great documentation and a lot of good publications describing this model.
Got it. Thank you, Nat. 2 more. So speaking of InMap, does InMap account for secondary pollutant formation downwind?
I believe it does, yes. But I don't want to speak certainly on that because it's not totally my area of expertise, but I do believe yes, because we input output in terms of SO2 and NH4, and it produces a PM 2.5 change. So I think it is estimating all of that.
Great. Okay. And let's see, 2 more real fast. Have you looked at the health impact from more than just air pollution in this work?
No, we have not. And that's actually a really interesting question. I would be interested to learn more about other kinds of pollution and health impacts from pollution, particularly from power plants that we could hopefully easily measure or model. And the nice thing about this approach is we're estimating based off of change in generation, change in activity from these power plants. So any outcome that we can link to change in activity, we could link to this model and sort of link those estimates together. But we haven't done anything like that. This is entirely just air pollution related.
Got it. Okay, thank you. Quick follow-up. I'm going to skip around here. on Rima's question, which was about the secondary pollutant formation, I believe. Zachary McCann writes, are the health costs necessarily attributable to carbon and CO2? There are a number of other emissions from power plants that could affect health. I think that's, you can speak to that a little bit. Thank you.
Yeah, totally. So, and let me be clear here, actually, the health damage costs are entirely from non-CO2 pollutants. Those health damage estimates that we have are entirely based off of pollutants that convert into PM2.5 into particulate matter and cause health damages. We do not estimate the health impacts of CO2 emissions. And I'm sure that there is probably some work that has tried to connect this, because certainly CO2 is having a long-term impact on human health. But we are not incorporating any of those models. So we do model both CO2 and particulate matter related emissions and the health damages from those separately.
Got it. Thank you. Okay. And then the last one is, how is the social economic status, the SES of the community that breathes the air that the generating stations pollute impact the health estimates?
Yeah, that's a really good question, and something we have certainly struggled with a lot. And I think it's a very complex question. I'm sure there are lots of people here at this conference talking about it. The way we don't have any explicit inclusion of that in our modeling steps, so we are not explicitly incorporating these elements into our model. And part of that is because sometimes there are a lot of different values and principles that people could choose to implement. And we work with a lot of partners. I'm going to talk about this next, how we sort of work with our partners. We try to give them the tools that they need to enact the kinds of policies and changes that they want to see. I think that social economic status and other outcomes are in some ways implicitly incorporated into the model, because the model is, I didn't talk about this, but the epidemiological research and studies often model changes to health pollution as a log linear relationship. And so that means that for each change in microgram of PM2.5, there's a proportional increase in the rate. So it's a percentage increase in the rate of premature mortality. And so that means that areas that already have very high rates of mortality have really poor health outcomes. If one microgram is going to increase it by 20%, if you're comparing an area with better health outcomes versus an area with low health outcomes already, the area with low health outcomes already is going to see a much larger absolute change in mortality. And we measure the absolute change in mortality. So some of this stuff is implicitly included in the model through that baseline outcomes, but we're not explicitly modeling that.
Thank you for that. And thanks for the question as well to the audience. I think that's something that we, as well on my end, spend a lot of time on estimating, different exposure response functions, both on the relative scale and the absolute scale, as Nat was just speaking on more clearly than I ever could, for different groups at different socioeconomic positions across the United States. So I think that'll be a really interesting area of opportunity moving forward as well. Okay, with that, I don't want to derail you too much more, Nat, in the remaining time. So I'll turn it back over to you. Thank you.
Yeah, thanks so much. And truly also, thanks for all of those questions. Those are all really great questions. I appreciate having an opportunity to make sure we're all kind of following along, because I know I'm trying to condense all this stuff that's loose in my brain into a short period of time. But I did really want to talk about some of the real world applications of this marginal emissions data. This is one of the things that excites me the most about working with WattTime, is not only are we doing research, but we're really focused on using that research to put information out in the world and start working with people who are actually using this information to make choices right now. So there are people using this data right now to make choices to hopefully reduce emissions. So there are a couple of main areas where we partner with people to use this data. And there's different ways of using this. So one of the major things that we work with is something that we've titled automated emissions reduction, or AER. This is just the concept of real-time dynamic load shifting. And so what that means is, we have our API where we're grabbing all of the data that we could get about the electricity system in real time. We're running our marginal emissions model and our forecasts, and we're creating those in real time, and we're providing them through an API. And then our partners are the ones who are operating devices in the real world. They have controls, the computers, systems controlling all of these different kinds of smart devices in the real world. And they're ingesting that data from the API, and they're using that to send instructions to those devices. And so that could look like changing an HVAC setting, changing your air conditioning setting, changing your smart appliances, changing your EV charging, et cetera. And so some examples of partners that we work with who are using this data in real time, they're largely using the carbon emissions data in real time, are Google Nest thermostats, Microsoft Windows 11, I think it is, can schedule software updates based off of when emissions are lower. And Toyota was one of our launch partners for this health signal. And one of the large motivations behind us developing this launch signal, when they launched their first battery electric vehicle, they really were concerned about, and there is some pre-existing literature that in earlier states of the grid, I think that there's some research that suggests that depending on when and where you charge your electric vehicle, you could actually be increasing health damages compared to an internal combustion engine if you are charging at times where pollution emissions are really high. And so they were really concerned about that, and they wanted this health signal to really help all of their customers charge at times when they weren't going to be when they were going to be minimally increasing health damage outcomes. I will say a lot of that research about electric vehicles increasing health damages is based off of the grid 10 or 15 years ago. And the US grid in particular has gotten very clean very rapidly, or much cleaner very rapidly. I don't want to say very clean because we're not all the way there yet. And those numbers, I think if you looked at them today, would look very different. But still, there's a lot of health damages we can avoid. And so just to give you a visual summary of what this automated emissions looks like, this is just an example time series. So in gray, we have a time series of what the marginal emissions rate, or the MOER, looks like. And we're imagining this blue period is when an EV vehicle is plugged in. So you're an EV driver, you get home from work, you plug your EV in, and it's connected overnight. And so a normal charger, a charger with no information, just immediately starts charging as soon as it's plugged in, charges for 2 hours, it's fully charged, and it turns off. And so we see that in the sort of gray brick here. And we see that in this signal, we know that the marginal emissions rate is actually still really high, but it drops in the middle of the night. And so a AER-enabled, an information-enabled charger can look at the forecast and say, hey, I'm plugged in now, but I think the marginal emissions are going to be really low 4 hours from now. So I'm going to wait 4 hours until I start charging. And so then it's able to charge at a much cleaner rate and reduce the total emissions associated with charging. And so that's kind of generally, this is kind of dynamic real-time load shifting, where partners are looking at devices and they're saying, I have to use this energy, but I have some flexibility. How do I use that flexibility to create the least amount of emissions possible? So another category where we work with partners to reduce emissions, all of that stuff was talking about in time. We also have a dimension where we work in space, so in geography, and that's around maximizing avoided emissions from new renewables. And so we work with lots of partners who want to purchase and sign new renewable energy agreements and PPEs, and they're willing to look outside of where they're located and say, actually, where could I build this so that it had the largest impact on total emissions? And so, for example, one of our first partners was Salesforce. They're based in California. California has one of the cleaner grids, particularly in the US, but also in the world. So building more solar, particularly building more solar panels in California, which already has frequent times of oversupply from solar energy, was going to have a much smaller impact on total emissions than building the same amount of renewable energy in a completely different region, which is dominated by coal. So they built in Western Australia, which has lots and lots of coal generation. And so building it there was going to displace that. And so we see that if you look across the world, there are very different possible values of how much generation you could displace by building new renewable energies. And so we've worked with a lot of really impact focused and forward thinking renewable energy purchasers, including Boston University. Boston University was one of our early partners in terms of they purchased renewable energy from a wind farm in North Dakota connected to the Midwest grid, which was much dirtier than the New England grid. And so this is another opportunity. We've done this primarily for carbon, but we can also do this for health. We could do this for co-optimizing. There's lots of flexibility there. And then finally, I wanted to talk a little bit more about some of those previous two, I would say, are kind of our core area of focus in terms of impact. We work with lots of really large organizations making decisions, and we provide them with these signals so that they can maximize the emissions impact. And that's kind of where a lot of our effort is focused. But I wanted to share, too, some of the other things we're doing in terms of research and policy and collaborations to try and move the whole field of understanding of marginal emissions forward. So Scott alluded to this earlier during the introduction, but we've actually met because we have been collaborating on some research recently around estimating the health impacts from the emissions induced by Bitcoin mining. And so this was spurred by a great research article in the New York Times by a reporter, Gabriel Dance, who did incredible work tracking down all of this information, creating this incredible catalog of where Bitcoin mines in the US are located, how much energy they're using, all of this information. And we collaborated with the New York Times, WattTime collaborated with the New York Times to estimate the carbon impact of all of the energy use from those Bitcoin mines. And so now we're collaborating with Scott and other researchers at the School of Public Health to estimate what are the health damages from those. And so we're really trying to just collaborate and understand and spread where those impacts are. And I think this is work that's still in the early stages. We're still developing it. I don't know, Scott, if you want to say anything particular about this plot or this presentation, since I know that this is a lot of the work that you're closer to right now.
Sure, I'm happy to. So real briefly, what you're looking at is model output from the same air dispersion models that Matt was speaking about previously. This is from an InMap run. InMap, again, just to reiterate, it's a lightweight atmospheric sort of chemistry dispersion model. So it shows you where pollutants go once they're spewed into the air by the power plants. And so what you're looking at is where we think, using WattTime's data, that links power plant Bitcoin mines to power plants. So we know where the Bitcoin mines are, and we know where the power plants that supply the electricity to those mines are. Where do we think the air pollution goes? And so you know it's not equally distributed across the United States. But just for context, Bitcoin mining in 2022 used more electricity than the entire city of Los Angeles. It uses an incredibly large amount of electricity, and it's marginal. It's just added. So Bitcoin mining didn't really exist more than, in the United States, didn't exist more than 3 or 4 years ago in any meaningful way. So we really needed WattTime's data on the marginal emissions, because Bitcoin mines came to the United States and they added to the load that was already there. So they need additional capacity. And we needed that data to do this research. Look, Bitcoin mining is one source of new load, of marginal load. that's being added to our grid, but it's not the only one. I think over the last 12 to 18 months, we've seen a massive increase in power usage from data centers connected to AI, into large language models. The amount of electricity required to train things like ChatGPT is prodigious, and it's actually exceeds that of Bitcoin by a factor of 2 or 3 or possibly even more. So one of the things that WattTime's data can do is also help us understand the broader sort of systemic impact of new technologies on air pollution, on greenhouse gas emissions, and ultimately on health. And that's what this effort is meant to start doing.
Yeah, thanks so much. And yeah, we frequently collaborate with researchers. We've shared our data a lot with researchers. We're always in this very weird gap of, we're a nonprofit that acts a lot like a private company. So we're very used to dealing with, private organizations, which is part of how we get this impact out into the world. Like, these are the people operating and controlling the devices. But we are still very much a nonprofit. We are still very research focused, but not everything, we're not an academic research group, so not everything is always out there as much. But I mentioned that just to say, if anyone is interested in using WattTime data, wants to learn more about WattTime data, I'll put up the contact information on the last slide. But we frequently do, free licensing for researchers to work with this kind of data. And then, yeah, the last thing I just wanted to highlight too is, so in addition to these research practices, WattTime is very involved with collaborating with lots of other groups to develop policies and best practices. One of WattTime's early successes was collaborating with the California Public Utility Commission on their residential battery incentive program. So California had developed a residential battery incentive where they would pay homeowners a certain amount to install battery storage into their home. And then they commissioned a study on it, and they found that those batteries were actually increasing carbon emissions because they were charging when electricity was cheapest, and when it was cheapest happened to also be when it was dirtiest. And so we worked with the CPUC, we gave them guidance. They developed their own marginal emissions signal. So they're using a marginal emissions signal. It's different from our marginal emissions model, but they are using that now to actually run those incentives. So they've completely changed that, and that policy is being copied now by other states. We're also members of several different, multi-corporation collaborations, including the Green Software Foundation, which is trying to develop software development standards for best practices for carbon-aware computing. So like you were talking about, this increasing data center and AI training usage is using a lot of electricity. There are a lot of software developers and software development companies that are really interested in figuring out how they can do that while minimizing the amount of emissions. And we work with the Emissions First partnership. And then we have this more recent collaboration with Veracity, which is a goal of working with other, I mentioned there are multiple ways to estimate marginal emissions, working with other marginal emissions generators, marginal emissions signal providers, to really establish some baselines around which signals and which methods and how can we test the reliability and validity of all of these things. So I just wanted to highlight to say is that we're a very open and collaborative organization. We really care about impact, and we know that the only way that we can achieve that is through partnering with lots of other people who can bring a lot of other skills and values to all of these kind of serious problems we're addressing. So that's it for my presentation. Thank you so much. I'm going to leave, this is my personal contact information, but you can also reach out if you have technical questions to support, or if you want to learn more about getting access to the data. If you want to test out the API, we do have a free plan that allows you to access one region. If you want to learn more about getting a license and access to the data, you can reach out to contact@watttime.org. Like I said, we frequently sign zero-fee licensing agreements for researchers and for research projects. But if there's anything more you want to learn, please reach out to us and someone will respond to everything there.
Well, thank you, Nat. That's extraordinary and extraordinarily helpful and extraordinarily interesting. We have about 5 minutes left. If the audience has any questions, feel free to put them in the Q&A or the chat. And as those questions roll in, I actually wanted to go back real briefly to the beginning and ask to see if you can speak just very briefly on, for our audience, just to underscore the point, why it's important to understand marginal emissions versus average emissions when we're doing these kinds of analyses.
Yeah, that's a great question. And it's because we're trying to say what's going to be the impact of making a change, right? Because that's actually the thing that we're doing. What we're proposing here is we're saying, I'm going to charge my EV at this time and not at this time. So this is a change to an existing system. And so it's important to understand how the system responds. And so that's why we think marginal emissions is really important. And we often encounter lots of people like estimating marginal emissions is really hard. Estimating average emissions is really easy because it is something you can measure. You count up all of the generation, you count up all of the emissions, and you divide the two. And there's no argument over what the correct value is because it is an empirically observable and easily measurable number. The problem is we think that marginal emissions and average emissions in many cases can actually be very different. And so we see this largely in places where you talk about some generators like nuclear generation and hydro reservoir generation in particular. Those are two sources where the operating emissions of both of those resources is zero, right? They don't generate emissions per megawatt hour that they generate, but they're also frequently what are called baseload generators. And that's because they also have very low operating costs. And so it is very rare that if if that adds up to 40 gigawatts of generation in your area, and your daily change in load is from 100 gigawatts down to 50 gigawatts, those 40 gigawatts are just staying on the whole time. And so if you were to look at the average emission signal, you might think that you had a much, much lower emission signal. But the reality is that nuclear generation, your turning on the lights does nothing to change that. It's always going to be at maximum capacity all the time because of how economic dispatch in the grid actually works. And so that's why we think it's really important to understand these marginal emissions and understand what the real world impact of making these changes are. I will say our signal is focused on what we call short run marginal emissions. So if I make this change now, what is going to change right now? There's also the concept of long run marginal emissions, which is still an area of active research for us. Whereas if I make this change now, what is the change 5 years from now? And those can be very different answers.
That's really helpful. I think, not only, it does the focus on marginal, match the policy and the behavior that you're trying to change in the short run. I mean, it also explains a phenomenon that you mentioned previously, where there was concern that charging EVs, for example, would have a net, a bad effect, would actually create more pollution. I think the reason, as I understand it, for that is that some years ago, 10 years ago, the grid, the base load sources for our grid was just dirtier. We had more coal-fired plants that were providing that base load, and and the natural gas-fired plants, which are cleaner, were to some extent in the past providing that marginal response, and that's switched. So now we have a system where the base load is largely provided by these natural gas-powered plants. The problem with that is that some of those marginal emissions now that marginal load is met by coal-fired plants. So if you just look at the average emissions, you miss the fact that sometimes, in some cases, those marginal emissions might be much dirtier. depending on the context. And so you have this dynamic system, and I think that's one of the dynamic system where the types of fuel that the generating stations use is changing, that the whole landscape is constantly changing. I think that's one of the, another facet of WattTime's data products that is extraordinarily helpful, because you're able to account for a lot of those changes over time.
Yeah, and I'll mention, right, a lot of our work is focused on the US, and that's where we're located and where we have access to a lot of data. And we are fortunate that a lot of coal plants in the US are closing, but that's not true globally. And so these kinds of concerns are still very real when you look at global electrical systems. There are lots of areas where there's still a lot of opportunity for impact in terms of moving away from coal generation in particular, but all kinds of fossil fuel sources. And that's actually where we really love to go next with this health emissions data, is because we have much better, much cleaner grid compared to a lot of other countries. We have much better pollution controls compared to a lot of countries. A lot of the impact for health outcomes from air pollution are in other countries outside of the US. And so figuring a way to get that data, I think, is a really important question in the future.
Well, Nat, I know WattTime continues to expand rapidly. This has been absolutely extraordinary. As I said before, I can't say it enough. To the audience members, if anybody's interested, I do encourage you to reach out to WattTime. Nat and his entire team are both brilliant, have tremendous insight, and they're also just damn decent people. So it's been a pleasure to work with everybody. Nat, again, thank you for your time today. Thank you to the audience, and please do follow up both on the conference platform and via email.
Yeah, thanks so much for having me.
Thank you, everybody.